Hi, I'm Eliza. I'll be performing your cranial nerve exam today. Do you have any questions or concerns before we begin? Okay, wonderful. Then let's dive right in. So the first thing that I want to do, I'm just going to be using this light to just scan across, and it's just going to feed back to my laptop down here. And I'd just like you to look at this eye chart as I do this, okay? So if I could just get you to read, let's say, the third line down from left to right, and I'm just scanning across, okay? And read the next line. Can you read it from right to left this time? If you can't see it. Okay, good. Let me just have a look. Okay. And read the next line from left to right. Just think that there might be a few. Good. Okay, and can you do this very last line? This line just here above the green from right to left. Okay, good. Could you go back along the line from left to right and tell me the colour of those letters? Yeah. Okay, that's wonderful, thank you. So, I'm just going to indicate a few places where it looks like your energy might not be flowing as it should be. Maybe just right here. And I'm just going to indicate these spaces, and then I'll do a slightly more thorough examination. Okay, let's just take this one here. Okay, don't worry, this will wipe right off at the end. Alright, now I'm going to use this tool to get a more accurate reading on those specific places, and I'm just going to apply some of this to activate it, okay? Let's give it a shake first. Okay, and it's just going to roll right on like this, okay? Good, I know it's slightly cool to the touch. Yeah. Alright, let's give that a second. Close your eyes. Okay, and I'm just going to set up for this test. Okay, I think we're ready to begin. So I'm just going to place this on those points. It shouldn't be painful or uncomfortable at all. If it is, let me know, but it shouldn't be. Okay. So let's just download this. Okay. Have you had any trouble with your sense of smell recently? Okay. What about headaches? Anything like that? Do you feel like you're straining when you look at things? Okay. Alright, well, I think that we can apply a little bit of this. And I think that this is going to help a lot with that. First of all, I'm just going to use one of these wipes to sterilize the area, and this will also remove those little dots that I put in earlier. Okay. Oops. Okay, right. Okay, great. And I'm going to apply a little bit of this, which will allow me to connect you up. So we can just sort that out for you. Okay, so I'm just going to apply this behind both of your ears. Over here on this side. And over here on this side. Okay. So then now I can just touch this one to this side. Just down there. Good. And on this one on this side, okay? And this is just going to allow me to adjust that for you. So you shouldn't be straining so much. Once those pathways are cleared. Okay, let's go back to this. Can you read once again this bottom line here from left to right? Okay, great. Can you tell me what colour this one is? Good. And what colour is this one? What colour is this one? Okay, great. How does that feel? Can you feel a difference? Yeah, okay. Okay, then that seems like it's working perfectly. I can just remove these for you. And on this side. There we go. Okay, perfect. Now, let's just look at your sense of smell. So, let's go with these. I'm just going to hold this under your nose. Okay. Can you tell me what it smells like? Good, it's orange. So can you tell me if the smell is stronger or weaker with the light or without? Is it stronger or with the light or without? With or without? Okay. Good, and let's try this one. What does that smell like? Good, that's peppermint. And is the smell stronger with the light or without? With the light or without? With or without? Okay, yep, that's fine. And this one. Have a smell. What does it smell like? Good, it's strawberry. And does it smell stronger with, oops, my light is playing up. With the light or without? With the light or without? With or without? Okay, great. Yep, that's perfect. That's what we like to hear. Let's put this back on. Okay, great. Let me just make a note of that. Okay. Now let's have a look. Can you just take a few deep breaths in for me? Breathe in. And breathe out. Good, breathe in. And out. One more time, breathe in. And out. Okay, that all looks good. Nothing to worry about there. Alright. So I want you to look at the light. It might flicker or flash. Okay. And I'm just going to feel around your face and around your ears. Okay. And I'm just double checking that I can't feel any straining. Just checking that your muscles are activated the way that we would expect them to be. Okay. Good. Good, just looking at the light. Okay, we're going to do the same with the scents. Okay, so I'm going to put this under your nose, breathe it in, and I'm just going to feel around your face gently. Straining the tool. Okay, wonderful. That all looks good. Now, let's go on to some touch tests. So, I am going to either touch my nose with this or your nose. I want you to tell me who I touch, me or you. Okay, are you ready? Good. Good. Yep. Good. Mm-hmm. Good. 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 Yep. Mm-hmm. Good. Good. Good job. Okay. Now, so I have this soft brush and I have this wooden stick. I'm going to touch your face with both of these things, and I'd like you to count how many times I touch you with the brush, okay? So just ignore this, alright? You can close your eyes for this one. So this is the feeling of the brush. This is what the brush feels like. And this is the feeling of the stick. Okay, are you ready? So count how many times you feel the brush. Okay, how many times was that? Good job, well done. We're going to do the same but the opposite. So now I want you to count how many times I touch you with the stick, okay? Good. Okay, and that time, how many times did I touch you with the stick? Excellent, good job, well done. Okay, let's go to the next test. I am going to open a page. I want you to tell me the first word that you can see, alright? I'm going to hold it back here and I'm going to bring it closer. Just tell me what the first word you can see is, okay? Okay, good. And again. Okay, good, well done. Okay, excellent. One more time. Okay, good job. Now, I'm going to say some sentences very quietly, and I need you to listen and watch my lips and try to work out what I'm saying, okay? So, are you ready? Good. Did you get it? I said the girl studied history at university. The next sentence, are you ready? You went to the cinema to watch a film. You went to the cinema to watch a film. You went to the cinema to watch a film. Did you get what I said? I said he went to the cinema to watch a film. Okay, last one. She learned to write a book when she was 5 years old. She learned to ride a bike when she was 5 years old. She learned to ride a bike when she was 5 years old. What do you think I said? I said she learned to ride a bike when she was 5 years old. Well done. Okay. Okay, good job. We have a few more tests to do. So for this one, I'm going to make some sounds with my hand. I want you to tell me if the sound seems louder or quieter or with the light? Okay. Okay. So does the noise sound louder with the light or without? Okay. And again, does the noise sound louder with the light or without? With, without, with, without. What do you think? Okay, let's do it one more time. Okay, was the noise louder with the light or without? Okay, great. We'll do the same. I'm going to whisper some numbers. I'm going to whisper some numbers with the light and some without, okay? And I want to know which ones you can hear more clearly. Okay. 987. What did I say? Just repeat it back to me. Good. And again, just repeat back the number that I said. 63. Good. And again, just repeat the number back to me. 1505. Good job. And again, 987. Okay. 10,752. Good. 21,909. Okay. 76. Good. 200,000. Good job. Well done. Alright. Oops. I'm throwing my pen all over the place. Alright. We are on our final test. So for this test, I want you to do the opposite of what I say. Okay? So look up. Good. Look down. Look to the left. Look to the right. Good. Look at my nose. Look at the light. Look at my nose. Look at the light. Follow the light. Good job. Follow my finger. Good. Open your eyes. Close your eyes. Open your eyes. Close your eyes. Look at my finger. Look at my nose. Look at my finger. Look at my nose. Good job. Well done. You've done amazing. You can relax now. You no longer have to follow my instructions or do the opposite of my instructions. So I can't see anything to be concerned about. Everything looks as I would expect. It seems that the readjustments with those blocked pathways has worked really well, but we will do a checkup for that in a few months' time just to see how that's going. How does that sound? Okay, great. Thank you so much for coming in, and I'll see you soon. Thank you. Bye.